Don't have a quorum, so we'll start as a subcommittee. And we do have a member that has two bills in front of us today. Don't go out the door, Senator Bell. Are you ready to present, Senator Bell? Yeah, okay. You have today we have 10 bills, one on consent.
Okay.
And Senator Bell has two bills, items 1 and 3, and they're very, I don't want to say complicated, but they're complicated.
Everything's complicated.
And
Early in the morning, it's good to be
it
complicated.
is early in the morning, and I want to thank my staff for doing a very in-depth analysis on item 1, SB 884. So would you like to begin with?
884?
Sure. Thank you.
Madam Chair, thank you very much. This is SB 884 we're presenting at this time. This is the bill that is a companion bill I'll present after this is SB 1113. Both these bills were the result of a audit that was presented earlier this year to the Joint Legislative Audit Committee. And the request was submitted by myself and 9 other members of the legislature. The state auditor completed an audit. And these bills have the result of the audit. So it follows that the audit raised several issues. The issues that address in SB 884 deal with one set of issues. The second bill, SB 1113, deal with another set of issues. So that's why the two bills are separate. I'll start with this bill. First of all, I'd like to gladly accept the committee amendments and suggestions. We are taking those amendments as authors' amendments. The state auditor examined whether school districts are meeting their legal obligation to provide appropriate services to students with a mental health condition. In 1984, AB 3632, this was actually by Speaker Brown. It's one of the bills that Speaker developed. This bill was to implement, require county mental health agencies to provide mental health services to students with disabilities. In 2011, however, this was modified by a budget trailer bill. It wasn't going through policy. And that's one of the reasons we're doing these bills. This was something that changed during the budget trailer bill without any real discussion of the policy issues. AB 114 removed the mandate due to the budget cuts. It was kind of a result of that, and gave school districts the responsibility for ensuring students receive the necessary mental health services. The previous bill, AB 3632, required more of a joint kind of cooperative effort. And so 114 pushed it all over into the laps of the school districts. The audit report determined that the schools weren't providing sufficient record keeping on students' performance outcomes, the lack of state funding documentation, and also significant changes that were made in a student's individual education plan, or IEP, were left unexplained, which in some cases the schools failed to notify the parent. The Select Committee on Mental Health had a hearing on this, and we heard from some parents describing the situation that happened to them in that regard. SB 884 seeks to provide fiscal transparency of mental health funds, which are separate from any other funds that are given to school districts. It's not lumped in with the other funds. It's a separate segregated fund for mental health. And we want to require the school districts to simply report their allocations and expenditures to the Department of Education, requiring the schools give parents written notification of any changes to their child's IEP, and provide information materials, the basic information regarding their rights as parents. This measure ensures statewide transparency and accountability of mental health funding, student outcomes, and parent-guardian notification protocols. I'll turn it over to my witnesses, Madam Chair. Thank you very much.
Thank you. In support of the bill, please.
Rusty Seelix, Mental Health America of California and California Council of Community Behavioral Health Agencies. As the Senator noted, when the hearing was held on the audit of the AB 114 program, and since its inception, we've been hearing anecdotal stories from parents and providers and others that many children are falling between the cracks and aren't doing well. The data currently available from the Department of Education doesn't provide a lot of clues. It shows that overall statewide, the same number of kids are being seen and getting the same total number of services. The only thing we have seen is a 40% reduction in residential, which could be a good thing, but also could be a bad thing. We don't know. The bottom line is we just don't know. What we know for sure is that there are places where the program's working really well and places where we think kids are falling between the cracks, where the schools have tried to do things differently than the counties were doing them, and it's not working so well. And we see this bill as taking an important next step in trying to provide a little more information so we have a better idea on what's happening with these very vulnerable students with serious emotional disturbances who are in special education. And hopefully it'll then help us see where are the best practices so that other school districts will learn what are the better approaches that should be done, so we'll have more success overall. And that's why I support this bill.
Thank you. Others in support of the bill?
Anna Hasselblad with the Steinberg Institute. We are dedicated to advancing sound public policy and focusing leadership on the issues of mental health. We are confident that SB 884 will ensure greater transparency and accountability for our most vulnerable students in California's special education system who experience mental health service needs. Educators have long recognized that signs of mental health issues emerge at a young age and that early intervention is key in preventing and treating children with a mental illness with worsening symptoms, falling behind and dropping out of school, juvenile delinquency, and a future marked by lower standard of living than their peers. California's public schools have an important responsibility to identify and respond to the comprehensive mental health needs of youth and ensure that services are appropriate and effective. SB 884 will establish a clear and stringent process of documentation of finances and student outcomes and will better inform and involve parents in the IEP process. SB 884 is a smart and timely step to better meet the needs of our student population in an effective and transparent manner, and we respectfully ask for your aye vote. Thank you.
Thank you.
Linda Way with Western Center on Law and Poverty. In our own research, we found that there are children that are going out without needed services, and so we do support this needed bill.
Thank you. Others in support of the bill?
Good morning. Danielle Millay, California Alliance of Child and Family Services, also in support.
Thank you. Others in support of the bill? Is there anyone opposed to the bill?
Madam Chair, thank you. Alice Kessler here on behalf of the SELPA Administrators of California. We do not have an opposed position. We haven't taken a position to date, but we've been working very closely with Senator Bell's staff and are continuing to engage on the issue. There's some concerns with the drafting. I think the committee's amendments, which the Senator has taken, address a lot of those concerns, but there's still some remaining issues that we look forward to continuing to work with Senator Bell on. Thank you.
Thank you very much. Any opposition? Okay. Any questions from members? No questions from members? I'm sorry, Senator Pan, you missed his presentation, and this is the subject matter that was.
I got another one, too.
No, I know. He has another shot at it. He has another shot at it, but Senator Pan had a select committee yesterday on special needs children, and there were some SELPAs there that were talking about what they were doing in conjunction to this issue. Senator Pan.
Okay. Well, thank you, Senator Liu, and certainly, I also appreciate being at the Select Committee on Mental Health hearing on the audit as well. And so I think just I'm sure that as you're having conversations with the SELPAs as well, we want to be sure there's accountability and also to strike that right balance between accountability and the amount of documentation that's necessary. But that was the subject of some of the testimony at the Select Committee on Children's Special Needs. But again, I appreciate the efforts of Senator Bell in trying to be sure that that kids are getting the support they need, the mental health services they need.
Okay, thank you. Is there, well, first of all, let's call the roll. I think I have a quorum.
Lou?
Here.
Lou here. Block? Hancock? Huff? Here. Huff here. Leyva? Mendoza? Monning? Here. Monning here. Pan? Here. Pan here. Vidak? Here. Vidak here. That's 5.
Thank you. Do I hear a motion on the bill? The bill has been moved. Senator Bell, would you like to close?
Just that I know we're going through a transition. I'll work with the SELPAs. I think the issue is that what the audit found out is we don't know where the money's going and what it's used for. So we start there, and we have to work with the SELPA to document, get the data, develop a system to present the data and present what the money's used for and what the results of the performance of what that money's used for. This is segregated money for mental health services for students, and we need to fulfill the responsibilities we have to measure performance and find out if we're using the money appropriately. And I urge and I vote. Thank you.
Thank you. Let's call the roll.
Okay, this is item number 1, SB 884. The motion is due pass as amended to appropriations. Lou? Aye. Lou, aye. Block? Hancock? Huff? Aye. Huff, aye. Leyva? Mendoza? Monning? Aye. Monning, aye. Pan? Aye. Pan, aye. Vidak? Aye. Vidak, aye. That's 5.
5 votes, sufficient for passage, but we'll hold the roll open for our absent members. You have item 3, SB 1113.
Okay, Senator, Madam Chairman, and members, of course, this is our companion bill to this. This deals with more of the financial sides of issues on this subject. The audit found that local education agencies and counties could benefit financially and improve our students' access to mental health services by joining forces and providing services to Medi-Cal eligible students. The audit pointed to specific school districts that are doing some pretty good things and creative things that are financially benefiting and by contracting together with the counties. And I'll give you an example, 2 of them. School districts such as Mount Diablo, which is in Contra Costa County, I believe, and they have been able to access roughly $1.3 million in federal funds per year from the county for these mental health services. Desert Mountain SELPA agreement with San Bernardino County has allowed them to access almost $4 million in federal funds for fiscal year 14-15. Although these successful models clearly show that partnerships envisioned by our bill benefit both the counties and the local educational institutions, they are rarely implemented by the local education institutions. Local education institutions by law cannot access funding from it's called the EPSDT, early
and periodic
screening and diagnosis funding. Senator Pan and Monning know this one. Services unless they contract with the county. So there's this federal pot of money to do these screenings that help identify what the issues are with a special needs child, and it's available for all the Medi-Cal children, which is a huge number in California. But we need to break the barriers to access that money, to get that federal money that they're entitled to under the federal law. We need the LEAs and counties to work out They have some disagreements and problems over who should pay for the state match because it's a state-federal match program. So what the bill does is provide financial incentives for LEAs, the schools, to establish demonstration partnerships with the county to deliver quality school-based mental health services to more children. I'll just say to the committee, my goal is to have every child be diagnosed through such a EPSDT process, and this is not with the bill, that's my dream more than anything else. And I'm sure others share this, that we want all the children diagnosed early so we can identify what the special needs issues are for the child, and then appropriately fund it and develop a plan with the school and the medical institutions to accommodate the special needs of those children. So having been a county supervisor for 12 years and working with the school districts, I think these links are very important that we develop. When you talk about linking government silos, it's an uncomfortable topic, yes, but it needs to be done in this case because we have over 700,000 children in California with serious mental illness, and about 125,000 of them are serviced through the IEP process in the schools. So we need to develop a better and improved performance in California, providing mental health services and funding for kids in our schools, and this is what the bill is going to do. Thank you, and I have witnesses.
In support.
Thank you. Rusty Seelix, California Council of Community Behavioral Health Agencies and Mental Health America of California. And the dream that Senator Bell spoke of is exactly what these partnerships actually do. They actually provide support by the teachers meeting with clinicians on a weekly basis to identify all of the students that the teachers see as having any level of risk or any level of need for additional support. The county-funded provider brings Medi-Cal dollars to pay for all the costs of the Medi-Cal students through EPSDT for both special ed and non-special ed. The schools pay only for the non-special ed, non-Medi-Cal students, and the models have demonstrated that by doing that, you reduce the number of students who need the high-level special education costs, particularly in non-public schools, where those students cost $60,000 per year. So that's why we think this model, by expanding these pilots, it will demonstrate that this is not only the best thing for those students to enable them to succeed, but it's actually a financial winner for both the school districts and the counties. And so we're hoping that more of these partnerships can be formed and that this will become a model that will be widely used and that we will get to the place that Senator Bell stated, because we know that the school is the best place for that early identification of a child who may have mental health problems. The story that we hear is that there's an average of a 6-year delay between when a parent first knows that something's not right with their child and when they get diagnosed with and treated for mental health. And invariably, it's a fail first. They're either in special ed, child welfare, juvenile justice, or some combination of those. That's what usually happens first. That's the paradigm we want to change. And this bill is, I think, the best bill I've seen in a long time to do that. So we strongly support this bill.
Thank you. In support.
Good morning again. Anna Hasselblad with the Steinberg Institute. SB 1113 would allow for partnerships between county mental health and local education agency to provide on-campus support to identify students not in special education programs who the teacher believes may require mental health services, and with a parental consent, provide mental health services to those students. Educators play a key role in the development and mental wellness of their students and are especially well positioned to recognize the signs and symptoms of an existing or emerging mental health condition. This bill is an opportunity to move away from the fail-first model we have today and give schools, providers, and parents tools and a clear process to address mental health needs the moment they present and not years down the line. SB 1113 will result in better outcomes for our youth academically, their overall development, and in their communities. We respectfully ask for your aye vote. Thank you.
Thank you. Others in support of the bill? Okay, is there any opposition to the bill?
Madam Chair and members, Laura Wasco with the Special Opportunities for Access and Reform Coalition, SOAR. We are a group of SELPAs in Northern California, Solana, Napa, Yolo, Merced, Humboldt, Sutter County, and we have been working on the whole issue of EPSDT funds and allowing education access to these dollars for the last 3 years. We have sponsored legislation in the last 2 sessions regarding these issues. We've hit some stumbling blocks. We are a tweener. We're not in opposition, but we do have some concerns with the current proposal before you. Our bill last year would have allowed LEAs to directly apply for EPSDT funds. We hit some hurdles with that. We have been working with Senator Bell's staff regarding this issue and trying to find a happy medium for LEAs to have access to these dollars. We do not, there's important issues that we should look at as you look at the concerns with the bills. One, our concerns have been noted in the staff comments. So those are some of the issues. The one issue that has not been raised, and we think is a very important issue, is that there is no appeals process in this bill if the LEA and the county mental health agency do not agree on the delivery system for EPSDT funds. So what happens is if the counties and LEAs do not agree, then LEAs cannot access those dollars. So we would like to see an amendment placed into the bill that would allow LEAs an appeals process either through the Department of Education or Department of Healthcare Services to try to reach agreement so that these services can be brought to these students for those important issues. So we'd like to work with the author on this and other amendments. Thank you.
Thank you. Another tweener?
Another tweener. Thank you, Madam Chair. Alice Kessler again for the SELPA Administrators of California. And again, we've been having many discussions with Senator Bell's office on this bill as well. We agree that we should be trying to get as much money, federal money, drawn down for the state as we can. I think we, however, still want to continue working on how this is funded, the sources. One point to note is that we're talking about these different universes of mental health services. There are those who are in special ed who may have mental health services as part of their IEP. There may be other students who do not have an IEP who also need mental health services that may be provided by the county. And that shared responsibility is where we get into some gray areas. And from our vantage point, we want to ensure that that special education funding, which is already very underfunded, that we're protecting that. So I think we want to continue to work with the senator as the bill moves forward to Health Committee, and I know Senator Pan is also very interested in these issues, so we look forward to working with you. Thanks.
Thank you very much. Any other tweeners or opposition? Okay, questions from members?
Madam Chair,
Oh,
can I
sure.
clarify something?
Sure.
I forgot to say something to you when I
Absolutely.
apologize. First of all, I want to address amendments because I forgot to say that I have agreed to take committee amendment to require the partnerships have an exemption to use the AB 114 fund for non-IEP students from the Board of Education. Additionally, I'll inform you that we're submitting amendments to the Health Committee, which is the next committee reviewing this, to strike out sections 2 and 3 in their entirety. As written, these sections mandate private plans to reimburse LEAs for relevant services by counties. We're going to continue to work with the private plans, but at this time we're striking those sections. My intent is not to create another mandate. It was simply to encourage private plans to work with school districts to the extent mutually agreed to. A lot of the coverage for the mental health under the mental health parity laws is covered by private plans, so we have to connect the private plans better with the schools. We'll attempt to do that in other ways other than mandating it. I just wanted to clarify those amendments that we're taking now, and then the Health Committee will review the other.
Yeah, appreciate that. Senator Pan?
Keith, Senator Liu, I just want to mention that actually just we had a wonderful presentation by the SELPAs over in the Desert Mountain SELPA, who's coordinating with San Bernardino County, and hopefully we can try to encourage more of those models across the state. so to ensure that children do get access to mental health services, not just in their entirety. So again, I appreciate the work that you're trying to do, Senator Bell, on this bill. Thank you. I'd be happy to move the bill. There's no other testimony.
Thank you. Any other comments from members? Okay, would you like to close, Senator Bell?
As you can see, it's a new area, right? So we have to look at the ultimate goal of having all the kids screened. I think if we agree with that, and let's move this bill in that direction, this will be a big, significant step. We'll continue working over the next few years to have every kid diagnosed and treated as early as possible, because we know that's the more effective way of treating mental health issues with children. And I urge and I vote, and thank you for your comments, and thank the staff for their work on this too.
Thank you very much. Appreciate your work in this area. The bill has been moved, and let's call the roll.
This is item number 3, SB 1113. The motion is due pass as amended to health. Oh, I thought he accepted it. Sorry. Due pass to health. Lou?
Aye.
Lou, aye. Block? Block, aye. Hancock? Huff? Huff, aye. Leyva? Mendoza? Monning? Monning, aye. Pan? Aye. Pan, aye. Vidak? Vidak, no. That's 5-1.
5-1, the bill is out, but we'll keep the roll open for our absent members. Thank you very much. We see Senator Laura. You have item 4, SB 1146. Thank you.
He did. Okay, just for
Close, but no hair.
Thank you. Thank you, Madam Chair and members. SB 1146 would close a loophole that allows private universities to discriminate against students and staff based on their gender identity, gender expression, or sexual orientation. Title IX, members, plays a critical role in protecting students and staff by prohibiting discrimination based on gender identity, gender nonconformity in education programs. When a student or staff member at a university believes they have been discriminated against, they can use Title IX to seek remedy and damages. However, there is a loophole that private universities use to request an exemption and avoid complying with non-discrimination laws. Universities that receive the exemption essentially have a license to discriminate, and the student and staff have no recourse. Over the last 3 years, there has been a significant uptick in the number of universities who applied to receive an exemption from Title IX. Only one school was granted the exemption in 2013. Today, there are at least 43 schools that have received an exemption nationally, and 6 of those are in California. The universities that receive these exemptions do not have to disclose to their students or staff. Students and staff across the country have reported finding out about the exemption only after being expelled from school or fired from their job. Recently, a university in Southern California, not USC, a university in Southern California, a student took a leave of absence and during his time away came out as gay on social media. When it was time to return to school, that university did not want to readmit him. Transgender students also reported being denied access to gender-appropriate housing, and some have been expelled as a result of their revealing their gender identity. Classrooms are supposed to be a place where students feel safe and can learn without fear of discrimination or harassment. California has established strong protections for our LGBT community, and private universities should not be able to use faith as an excuse to discriminate and to avoid complying with state laws. SB 1146 would require universities who are granted a Title IX exemption to disclose that information to the California Student Aid Commission and disseminate this information to students and staff. The bill will also allow an individual that has encountered discrimination at a school claiming a Title IX exemption to pursue a remedy through civil action. Thank you, members, and respectfully ask for your aye vote.
Thank you. In support of the bill, please.
Good morning, Madam Chair and Senators. Joe Michael for Equality California in support of the bill. The Senator stated very well the need for this, and we strongly support all of the efforts to address this issue. The exemptions that schools are seeking for Title IX create an opportunity for discrimination, and often, as the Senator said, students and staff at these universities don't know that they could be discriminated against and don't have sufficient recourse to address that discrimination if they face it. So this is a very important issue, and we strongly support all ways to address this and think this bill provides a really good pathway to increase awareness about this and ensure that students and staff have an opportunity to seek a remedy if they are discriminated against. We respectfully urge the committee's support today. Thank you.
Thank you. In support of the bill?
Yeah, hi, Amanda Wallner with the Los Angeles LGBT Center. Thank you for your time. And we are in strong support of the bill as well. I think we all probably remember that adolescence can be a difficult time for most people, and for LGBT youth who are figuring out their sexual orientation and gender identity, and coming out to their friends and family for the first time. This is an especially difficult time. We know that LGBT youth are 3 times as likely to have depression and other mental health issues, and they're more likely to attempt suicide. And Title IX ensures that these vulnerable students have equal access to services that will keep them safe and healthy on all California school campuses. Exempting schools from these protections undoes the steps that the state has taken to keep students safe. And as the Senator mentioned, California has some of the best laws in the country around that. And the least we can do is make sure that LGBT students know that their schools are requesting these exemptions. California, once again, has a chance to lead the nation when it comes to LGBT issues, and particularly when it comes to protecting LGBT youth. Since the Title IX guidance came out explaining that transgender and gender nonconforming students are protected from discrimination, the number of schools requesting Title IX waivers has skyrocketed. And at a time when states across the country are enshrining the right to discriminate into their constitutions, California can take a stand and say, not in our state. This bill will help protect LGBT students, and I respectfully ask for your aye vote. Thank you.
Thank you. In support.
Good morning, Erica Romero on behalf of the Association of Independent California Colleges and Universities. We had a call with our executive committee this morning. We are in a support if amended position. We do have areas of concern. We met yesterday with the senator's staff, and we've already let them know we'd like to do a follow-up meeting. We want to thank the senator and his staff for their willingness to work with us, and we will be providing them amendments. We look forward to working with them as the bill moves forward. Thank you.
Okay, thank you. Any others in support of the bill? Is there any opposition to the bill?
Thank you, Madam Chairman. Oh, there we are.
Yeah.
Hello.
You're on.
I'll talk loud. Okay. My name is Ray Burnell. I'm with the California Catholic Conference. At this time, we have an opposed unless amended position. We respect that there's an appropriate role for the state in protecting against discrimination. However, we're concerned that the narrowing of the exemption as it's written now may actually coerce a waiver of federally protected constitutional rights. So we would welcome the opportunity to work with the author and to address our concerns. Thank you.
Okay. All right. Thank you. Any others in opposition? And any comments or questions from members? No questions or comments. Okay. Senator Laura, would you like to give us your last pitch?
Members, I thank you for your time and respectfully ask for an aye vote.
Okay. Thank you very much. Is there a motion to move the bill? The bill has been moved.
This is item number 4, SB 1146, due pass to judiciary. Lou?
Aye.
Lou, aye. Block? Block, aye. Hancock? Huff? No. Huff, no. Leyva? Mendoza? Monning? Pan? Aye. Pan, aye. Vidak? No. Vidak, no. 3-2.
3-2. We'll leave the roll open for our answer.
Thank you, Madam Chair, members.
Thank you very much. Okay, we see Senator Galgiani in the audience. You have item 7,